is John. I'm 44 years old, and I'm here primarily today to, to rejuvenate my body, my spirit, my soul, my energy. I am very proud of myself for being here today. For a long time, I was in denial, like a lot of guys my age, in their 40s. I'm 44 years old, thinking that, they're Dionysus. They're the guys that they were 23. But when your body starts feeling 38 and you have kids and responsibilities of work and, all the overload that's going on when you're later in life, you need to take a position to start to look at the longevity of your life and how you're going to feel when you're 50, 60, 70. So when I started thinking about that, I wanted to come here and to take the necessary steps to feel young again.
One of the most common comments that I hear, even from my female patients, is the fact that their husbands themselves have had a change in their level of, if you will, aggressiveness or sexual desire. And a lot of that has to do with drops in the testosterone level in a man as he approaches middle age. And frequently, men will not address that as openly as their wives will.
I feel that I pretty much let myself go the last 15 years of my life. I have 2 young children, working full-time, have a million responsibilities, and glad I came in because I'm considering, not only the natural way of feeling better about my testosterone level, although it's very low, getting back into the gym, but I also am seriously considering other methods.
John, nice meeting you, and I understand today you have some issues about what's going on with you personally as you're getting older. And I'm here to see what we can do to help you with that whole process.
Thanks for seeing me, doctor. Yeah, I turned 44 a couple months ago, and I just noticed lately I haven't been feeling so good. Just not a lot of energy to do stuff. Started going back to the gym just recently. It's been a while for me. And just I was real concerned. My wife actually prompted me to come in. Our sex life hasn't been so good lately either. So I wasn't sure if those things were directly derivative of each other or not. So she's been complaining.
Okay.
So I'm concerned about that as well. But my health is the main issue that I'm here for, and I understand that you're the man. Dr. G's the man to be seen. So I want to do something about it.
Okay, well, one of the key things we look at in men at your age is these key hormones that have everything to do with not just your health, but also your psychological well-being. Testosterone being one of the most important, although not the only one that we would want to look at. And obviously our whole goal here is to help you stay healthy as possible and psychologically feeling your best without the need of any replacement type therapies. And the first thing I always recommend is getting back to the gym. Exercise is one of the easiest and inexpensive ways to elevate your hormones. And exercise itself will not only elevate your testosterone, your growth hormone, your DHEA levels, but in general even help with your brain chemistry and your sense of well-being. So that would be the first step in kind of really trying to look at what we can do to help you. But if we take a peek at your blood values, I don't know if you had any blood tests done recently, they would also give us an immediate snapshot of where you are.
Yeah, I got some recent work done for my blood, and the tests were coming out low as well, so I was concerned about that.
And that was your testosterone level you're referring to?
Yeah.
Okay, well, this is a normal sign at 45 when these key hormones really start to decline. So this is certainly something we could focus on and work on. Again, I would start with a change in your exercise and diet regimen, then repeat these blood tests probably in about 6 weeks to really see what you were able to do with your own, intrinsic genetic ability, so to speak.
Okay.
And we'll also make some recommendations on how you might change your diet, how you might actually change your mind state as well.
Okay.
All of these things figure into the environment that surrounds your genes and can make them work more optimally without having to replace things if it's not necessary.
Okay, and doctor, when you mentioned diet, what are we talking about? Like, how would I have to change my diet?
Okay, well, testosterone is a hormone that really is based on how much protein you take in and a number of other key things in your diet. One of the easiest ways to lose your testosterone level is to have a diet low in protein. And protein builds muscle mass. Muscle mass, when you exercise, will elevate your testosterone level. It's kind of a united cycle.
Okay.
So we would certainly look at your protein levels. We look at cutting down on high glycemic index carbohydrates. We look at also doing other things, spacing your meals apart. and also really spending some time with aerobic muscle building exercises
Okay.
to change your body fat and muscle mass composition.
Okay, yeah, that sounds great.
So your focus in the way I'm reading this is you want to go with an all-natural approach initially to see if we can't do this and let your body do everything it needs to do.
Yeah, I mean, I think that's the better course for me to
Okay.
take. Yeah.
And that's the wise way to go from the very beginning. I think exercise will not only be able to do this to a certain degree, but it's also going to make you just feel better psychologically
Sure.
from getting back into a good, healthy lifestyle routine.
Yeah, sure, sure. Having children has been a real difficult thing for me. I had them late in my life at the age of 39. I have a 1.5-year-old and a 5.5-year-old, and not the dad I used to be, that I would have been 10 years ago when I was 29. So it's catching up to me. I want to see my daughters graduate from college and have children and be a young grandfather and be a guy in the beaches of Barcelona that looks like 50 and I'm 75. So that would be a great dream. So that's why I'm here.
If we can improve how we all age, and invariably we'll have to age, we improve, more importantly, the quality of life that we have, the time that we have with the people we love and want to be with, and we also dramatically decrease the severity and degree of age-related diseases we all invariably will experience.
So my family history pretty much is, men do not live after 65, unfortunately. Most of it was because of black lung cancer. People didn't take care of themselves as well. I think what's very important for me, because I know that early on in my father's life, he was a smoker. I'm not a smoker. It's something I just have not done at all. And I drink casually, but the important part is that, your body slows down as time goes on. And to stay in shape and to have that vigor that you had when you were 20, 25, you have to work a lot harder at the age of 30, 35, 40, 45. And what I learned about getting together with, Dr. G in my consultation is not only is working out essential and important for your youthful energy and for my children, but for yourself. It's extremely important that, men don't take it for granted and that they just make it a lifestyle, a lot like California lifestyle. That they make it a lifestyle that I'm going to the gym, I'm getting my cardio, I'm getting my free weight workout in. If they need to do testosterone, and other, methodologies to feel good about themselves, that they can do so. And, also just from a point of perspective to, keep themselves and their partner happy in a relationship, it's essential. It's essential. So for me, it's been, extremely important to sort of, make a decision to do something, to make it a part of my life, and to feel, that I can, be a 44-year-old guy, but feel like I'm 34 or 30, and I can be a 54-year-old guy and feel like I'm 45. And that's a very possible thing to do if you, make the choice to be focused and look at your body as a temple.